Hello, everybody. Andrea here with Dentalelle. Let's talk about how to get your portfolio done before the holidays. No stress, including your practice profile. So the whole thing, the portfolio practice profile. And I do also review your portfolio when you're done. So if you have signed up for the online portfolio workshop, I will leave the link for you guys on the bottom. If you sign up for that, send me your portfolio and your practice profile. I will email you on how to do that, and I will look through it for you before you actually submit it to the CDHO. I don't change anything for you, but I will write a full page, sometimes more, on things I feel you might need to improve on, things you might have to change, answers that I know are not correct. So let's say in your practice profile, if I know you're going to get audited, if you say no to something, I'm going to tell you. So it really is great. So sign up for that course if you need help. But in general, I want to talk to you guys about how to get your portfolio done before the holidays. So in the online profile course, I go through everything. So I go through, I'm actually just looking at my notes right now, so don't mind me. I go through all of the different indicators. So even when you are writing your practice profile, there's a fill in the blank where you have to write down exactly how you are logging your sterilizing and what you are doing for the monitoring. So you need to know your chemical indicators and the biological indicators. So those papers and spore testing. You need to know about internal and external indicators. So I talked to you about all of that. You need to know in general how to monitor your sterilizer. So how to test it, what to do if there's a sterilizing error, how you log that, the different steps that need to be done, quarantining. I talked to you guys about all of that. So you know exactly what to do. I talked to you guys about waterline disinfecting, so running the lines, how to shock your lines, and how to test your lines, and how often these things should be done. And red flags, basically. So I talked to you guys a lot about red flags for your practice. So what to really avoid to try to not get audited. If you're going through your practice profile, if you're saying certain things, then I will tell you, okay, this is what you need to fix ASAP before you submit your portfolio. You will likely get audited. Depending on how you do your portfolio, what you write down for infection control, sterilizing, manuals, all of that, red flags for the CDHO that will almost guarantee you will get that phone interview or the on-site audit for sure. So I talked to you guys about that. I talked to you guys about cleaning solutions. So what types of cleaning solutions you need, plus how to properly mix them. So I talk about that. AdPi. So this is more about your practice profile and your record keeping, but I go through AdPi. So I talk about the new Perio system, the AAP. I talk about clinical attachment levels, clinical attachment loss, however you want to say it. I go through that and how to calculate it, because that can be very confusing for a lot of people, whether the gums are puffy, swollen, or if there's gingival recession. I go through how to evaluate. So if you're trying to tell your client to brush twice a day, use the water pick every day, and use the mouthwash, and then you see them in 3 months and they're doing none of that, well, how do you record that in the chart? How do you talk to your client? Do you say, oh, well, too bad, just keep on doing it? Or do you try to change things, what works for them? So I talk about that also. The CDHO wants you to be evaluating. I go through planning. How do you plan out properly your actual appointments, depending on if the client has perio, if they have gingivitis, if they have gingival recession, if there's a lot of plaque, a lot of tartar, if you need to see them every 3 months, or is it every 4 months? Is it every 6 months? I go through planning and implementation with you as well. I go through appointments. So how do you work with your client to make decisions based on their care? Do you refer out, and when do you do that? The CDHO wants you to be referring. They want you to know that you're not perfect, you can't do everything. I'm going to teach you guys when to refer out and when not to, how to be client specific, how to do your record keeping. I'm going to give you guys actual templates. So you can look at my templates and say, oh, I'm not writing that in my chart. Should I be? I go through templates as well. So it's wonderful. I go through plaque, tartar, oral irrigation, how you should be writing that in the chart. What if a patient has heavy plaque, heavy tartar, the gums are bleeding everywhere? What you should be doing per appointment as per the CDHO. Are you not talking to them about oral hygiene? You probably are, but are you documenting that? These are things you have to do. So there you go. I go through manuals. So that's always a very scary thing for people. I go through the right manuals you should be having. Now, if you have the on-site audit, I go through all of the manuals in detail, meaning all of the different logs. There's literally hundreds of pages, maybe even close to 1,000 pages of manuals that you should have. So I don't give you the actual manuals in the online portfolio course, but if you do want them, so it is literally printing them off. You would just fill in the information for your practice. That would be in the on-site audit course. So I will put that link too if you want that. If you want to be prepared for your audit, it's a great course. If you're going through the on-site audit, you need this course because I will give you everything to be organized. But back to the portfolio course. I go through hand pieces, how they want you to take them apart, lubricate, sterilize them, including the motors. I go through all of the logs you should have. So for sterilizing, if there's any cycle faults, logs on how to clean your piezo, how to clean your Cavitron, how to purge the line. So all of those logs that you should be doing every day, weekly or monthly in some cases. How the reprocessing area should look like from clean to dirty. Hazardous waste. Do you know what is hazardous waste? How you dispose of that? What about sharps? Do you have a sharps container in every single room? You should be. It's no longer supposed to be just in the reprocessing area. What about cleaning up spills? Do you know how to do that? What if a client is sick and vomits everywhere? Do you know how to clean that up properly? I go through that. Vital signs. Are you taking vital signs on every patient or only at new patient exams? How do you document that? COVID pre-screening and actual forms. I go through the exact forms that I use, how I pre-screen my clients, and I go from there. Medical history. Do you have a good and detailed medical history form? You probably do. Most offices do, but I go through it anyway. Oral cancer screening. Are you marking that down on every single appointment? Are you doing oral cancer screenings? What about consent forms? In your record keeping, do you say that the client has consented, both verbally and written? That needs to be in there. And overall, you guys, of course, for the online portfolio course, I go through how to do your portfolio, how to go through the practice profile, and how to write your goals and goal statements. I go through learning activities and how to fill in the blanks for your goals. What you had learned, how to fill that out, plus the next one, which is what you have implemented in your practice. Did you learn something? And then are you implementing that in your practice? I go through the whole thing. So your portfolio, the practice profile, it's exhausting, but we talk about everything. That way you don't have to sit there alone at the dining room table wondering, what am I doing? What courses do I start with? How do I write my goals? Where do I start? I'm never going to get done. So let's focus on getting it done before the holidays. I go through all of that with you. You don't have to worry. Let me know if any questions. Sign up now. It's already November. Get it done before the holidays. I'll talk to you guys very soon and have a good night. Bye for now.